Hi, my name is Kayla Campbell and I'm a student nurse here at the University of South Alabama, and today I'm going to be performing an IV insertion. Here's my ID and I will now scan the room. And place my camera. And so I would first just begin by checking the hospital policy and order form, which is what I have here. And so there's an order for insert saline lock and AM for CT scan. And so now I would just gather all my materials needed and then perform hand hygiene. And then I would identify the patient using two identifiers. So here we have Jaguar Jones medical record number 4176352, medical record number 4176352, and I do note an allergy to penicillin both here on the patient's chart and on his wristband. So I'm just going to set this aside now. And so I'd explain the procedure to the patient. Mr. Jones, I'm going to be inserting an IV today. I'd provide the patient with as much privacy as possible, shutting any doors or curtains. I would position the trash can, perform hand hygiene again, and then I would raise the bed to an appropriate working height, lower the side rails, and the patient can be lying supine or sitting up in a sitting position. So now I'm going to remove my goggles and remove my glasses and apply my goggles. And I'm just going to organize and open my materials here on my bedside table, making sure to maintain sterile technique. And so now I would take my alcohol swab, dispose of that, grab my Luer lock on my saline lock and clean it with an alcohol swab really well. And then I would dispose of that, grab my saline syringe and apply it. And then I would just lie this back down and I would loosen the end cap and just leave that there. And so now I'm going to go ahead and remove my over the needle catheter and set it aside, and then remove my tegaderm and just set it aside. And so now I'm just going to verbalize 3 ways to choose or assess a vein site. And so you want to use the non-dominant arm if possible. You want to use the most distal site possible. And you want to use a spongy and bouncy vein. And 3 ways to foster vein distension could include stroking the vein, applying a warm compress for several minutes, or putting the vein in a dependent position. And so now I'm going to take my waterproof towel and put it under my patient's arm, and then I'm just going to assess for a vein site. And I'm going to take my tourniquet and apply this 4 to 6 inches above where I will be inserting my IV. And I would like to note that I do have my arm secured. If you hear any crinkling, it is from that. And so now I would assess the vein that I want to use, and then check the radial pulse. Okay, and now I would apply my clean gloves. I would take my ChloraPrep and scrub for 30 seconds with friction. making sure to go in all kinds of directions. And then I would dispose of this and let it dry completely without fanning or blowing on it. And so I'm just going to move my saline lock closer. I'm going to grab my over the needle catheter, or grab my needle and my catheter, and then dispose of the cap. I'm going to anchor the vein, making sure not to touch where I just cleaned. And then I would insert, bevel up at a 30-degree angle until I saw blood return. And then I would lower the angle and go another 1/4 inch. And then I would advance the catheter to the hub without advancing the stylet. Secure that. And then I would apply firm but gentle pressure 1 inch and 1/4 above the insertion site. Remove the stylet and put it in my sharps container. Remove the cap and apply my saline lock. Secure this while I get my piece of temporary tape. And now I will aspirate for blood return, and then I will flush going until all of the aspirated blood is gone. And so then I would remove this and throw it in my sharps container. And then I would grab my Tegaderm and apply it over the catheter, making sure to not go all the way over the hub, but to get it on there. And so now I'm just going to remove the outer wrapping, make sure and press down the edges well. And I'm going to set this aside and save the label sticker. And so now I would take a piece of permanent tape, let the saline lock fall into its natural position, and just apply a piece of permanent tape over the loop. And so now I would remove my gloves, making sure to go glove to glove and skin to skin, and dispose of them. And then I would clean up my mess, and I would take a label and put the date, time, and gauge of the catheter on it, and apply it to my transparent dressing. And then I would date, time, and gauge of the catheter on the label or the piece of tape on the transparent dressing. And then I would inform the patient on how to not dislodge the IV. And I would also inform them of any signs and symptoms of complication, which could include redness or inflammation around the insertion site. And I would also inform them to let me know if they are on fluids and their fluids stop flowing, or let me know if they see any blood on the insertion site or on the dressing. Then I would perform hand hygiene, and I would move on to documenting, and I would document the date, the time, the location where the IV was inserted. I would document the number of tries it took to get the IV inserted. I would document the length and the gauge of the needle. I would document the patient's tolerance to the procedure. I would document if there was a saline lock present, and I would also document if they were having fluids, and if they were getting fluids or receiving fluids. I would document the flow rate and the method of the insertion of the fluids. And so now I'm going to show you how to discontinue the IV. And so I would start by, I would place the absorbent towel underneath the arm, which I have here. I'd perform hand hygiene, and I'd apply clean gloves. And something I did not note earlier is, of course, once I got the IV inserted, I would have raised the rails to the bed, lowered the bed all the way, and make sure the patient is in a comfortable and safe position before teaching them or leaving to document. And so now I would raise the bed to an appropriate working height, lower the side rails, and I would go, and I'm going to start just by removing the transparent dressing towards the insertion site, making sure to stabilize the catheter. And I'm just going to set that there, and then I'm going to take a folded piece of gauze and place it right above the insertion. Remove my tape on the saline lock. And then I would slowly remove the catheter in the direction that the vein goes. And then I would assess the catheter for intactness. And I would look at the insertion site and make sure that there's no drainage, tenderness, pain, redness, and then I would hold the gauze on for 30 seconds with gentle pressure, and then I would have a piece of tape and I would apply it over the gauze and leave it, and then I would of course remove my gloves, glove to glove and skin to skin, clean up my mess. Perform hand hygiene, raise the side rails, lower the bed, and make sure the patient is comfortable. And that completes my IV insertion checkoff.